Hello and welcome to the Oral Health channel. I'm your friendly neighborhood dentist, Dr. Rudra Mohan, and today we're going to be talking about traumatic cheek bite. Let's start. So this is a very common problem that a lot of people have at any point of time, especially when you're eating something or when you're talking too fast or something of that sort, and suddenly something happens that your cheek comes inside and between your teeth, and you suddenly get a response and it's too painful at that point of time, and it goes on for about 7 to 10 days. This, my friends, is known as traumatic cheek bite. So what you need to understand here is very simple. It is very common. It is something that is very treatable. At the same time, it is something that is very avoidable. Let's talk about the commonality. It happens to everyone. It happens while you're talking, it happens while you're driving, it happens while you're doing something that requires a lot of attention, especially some dexterous work that maybe requires you to bite your cheek while you're doing something of that sort. Secondly, it is treatable. Generally, it goes about in 7 to 10 days, and it might give you symptoms such as a burning sensation or burning sensation while you're having citrus fruits or spicy food. At the same time, a lot of pain. Sometimes you might get a swelling there, sometimes you might get an ulcer there, for which first of all what you need to do is make sure that you get it checked out by a registered medical or a dental practitioner. Secondly, once you see what the presentation is, you can go about by ice packs, putting ice packs there, or at the same time doing warm saline rinses. Warm saline rinses means take lukewarm water and put salt in it and do a rinse as well as a gargle if possible. So let's talk about symptoms. Basically, you've injured, with the help of your teeth and your biting force, you have injured the mucosa or the inner lining of your cheek, which has led to a response of pain and burning sensation if there is an ulcer that has formed. What you need to understand is you can really go about your day if it's not too cumbersome, but if you're having symptoms that are really not bearable, you can definitely go for warm saline rinses, putting ice packs there, putting a topical anesthetic gel. Anything that is over the counter, you can probably ask your pharmacist or your dentist as well for that matter, not an issue over the phone, and put it there. You can even put a gum paint there and it will help. But make sure that if it's happening sporadically, means once in a while, it's alright. But if it's happening too regularly, you might have to look into the matter. What I'm trying to say here is, if let's say you are a person who has a job that requires a lot of dexterity and concentration, for example, let's say if you're a tailor, you will require to put the thread to the eye of the needle and you have to make sure that it goes through. Stuff like this, which requires so much of dexterity, definitely leads to most of us trying to concentrate very actively, and in that process we tend to grind our teeth or probably bite our cheeks. So if that is the case, you might have to change the habit. That's not how it works. Secondly, you might be doing it when you're nervous or when you're stressed out. A lot of people bite their cheeks and their lips when they are very nervous or stressed out. So you have to really understand that it has to be made sure that you need to take care of the stress as much as possible, and you need to make sure that whatever stress is being caused to you, you're taking care of it, you're managing the cause of the stress. And if at all it becomes too overwhelming, you can probably go and visit a registered medical practitioner or a psychologist or a psychiatrist regarding the matter and get the root cause removed. Secondly, now what you need to understand is it goes on its own. What you need to avoid at this point of time any acidic drinks, any sort of spicy foods, anything that can cause you more pain. What you can really do is go for a bland diet for the time being. If you feel this is a very chronic thing that has been happening to you over a very long period of time, you might want to get yourself checked out with the help of a dentist, and you might see in such cases you will have a probable line at the junction where your teeth meet, upper and lower teeth meet. So this might just be a very common thing that must be happening over a period of time, and that line is very visibly seen. It's not of much of concern, but rather if you do have some other habits such as oral abusive habits of keeping a tobacco in that area, and if the area goes white, you might want to get yourself checked out. It might be of some concern. At the same time, you don't need to worry about the fact that the pain will definitely go in some time, and if you feel that your teeth are very sharp, you might as well want to go to a dentist and get them rounded off. So this was all about traumatic cheek bite today, and I hope that you like this video. Please leave your lovely comments and constructive feedback for us so that we can improve whatever we want to deliver, and please write in the feedback section whatever videos you would want to be talked about. Thank you.
you.